speaking of people living longer, you may want to skip your next dose of vitamins. A new study from the University of Colorado Cancer Center suggests that some supplements can actually do more harm than good, some even increasing your risk of cancer. Is nothing sacred? Joining me now from the University of North Carolina Department of Medicine, Dr. Kevin Campbell. Welcome to the show. See, this is so annoying to me because you're told forever to do one thing, and then it turns out that what they've been telling you to do is actually going to kill you. Case in point, they did 12 trials involving more than 300,000 people. I mean, it's not like this was some fly-by-night thing. Number of supplements made you more likely to develop cancer, like beta-carotene. Developing lung cancer and heart disease was up by 20%, according to the university, for people who took more of that. Selenium supplements associated with skin cancer, vitamin E, an elevated risk for prostate cancer. Should I just throw my vitamins out?
Well, I don't think you necessarily need to throw the vitamins out. These were people who took excessive doses of vitamin, more than the recommended daily allowance that you see on that bottle. By how much?
I mean, it's like, so it says take one.
Right.
If you take two, that can be dangerous. Were these people taking like 10?
I think they were
like
taking
two?
Hundreds of times the usual recommended dose. I think that we've become a society that really thinks that we need a quick fix for everything. Rather than eat fruits and vegetables, exercise and diet, we want to take pills to solve all our problems.
But how many would you possibly take to think, taking a whole handful of these things and you think you're going to get a whole lot better? That's crazy.
A lot of these companies that make these supplements are really pushing them as the cure-all, be-all. And what we know is the FDA just doesn't regulate these things. And so you don't know actually what you're getting in these vitamins and minerals when you take them in the first place.
Do you think this dissuades people from taking a daily vitamin when they hear the headline news? Well, it turns out vitamins can cause cancer, and now tomorrow morning everybody's going to go, you know what, I don't need to take my vitamin.
I think that a lot of folks are kind of stuck in their ways, and I don't know that this is going to completely change behavior, but hopefully it will make people think about it. There's people who need supplements, but you need to do that under the advice of your doctor if you have a reason to take them.
So this one's amazing to me. Speaking of unexpected health effects, I want to get your take on this latest study from Australia where scientists have been using spider venom as non-addictive treatments for pain. This is pretty amazing to me. It's the Borneo orange-fringed tarantula, and they're using the venom that the spider usually uses to kill its prey. How does that work?
So most spiders, when they actually bite a human being or an animal to kill their prey, they inject a neurotoxin. And this particular neurotoxin from this particular spider actually blocks pain pathways, so you don't feel pain. However, it is used in the place of morphine or other drugs like that because morphine blocks all these pain pathways and they can become addictive. The thought is, if we can develop this drug for humans, then it will be something that will be able to block pain but not be addictive.
Very cool, because of course the spider wants to immobilize its prey, so it makes sense that it's sort of temporarily paralyzing the part of you that hurts so that you don't feel it. But I can feel PETA coming out of the woodwork saying, you know what, you can't use our spiders to feel better. Spiders are people too.
Well, when you hear this study and look at how they harvested the venom, they put the spider to sleep and then they stimulate the muscles in the mouth to secrete the venom. It sounds very scary.
It does, and PETA will not like that.
No,
I can guarantee you that. Thank you so much, Dr. Campbell. Appreciate it.
Thanks for having me.